Welcome everyone to today's webinar on innovative curriculum, a renewed focus for healthcare education. I'm Stella McKernan and I'm a policy officer at the Council of Deans of Health, and I lead on our innovation and pedagogy work stream. So this is our second and final Innovation Month webinar. So today we're going to be exploring different ways innovation is embedded into healthcare curriculum in the UK. You may have seen that the Council recently published a report, Post-Pandemic Progress, Lessons Learnt in Healthcare Education. And this report provided some case studies from our members of innovative pedagogy in the form of healthcare practice placements that were brought about during COVID-19. And with this webinar, we hope to showcase some more examples and build on that discussion. The healthcare sector continues to innovate at pace with the rise in AI and digital health, and care delivery is expanding outside of hospitals to more community and at-home settings. The health sector is grappling with the rising demand for healthcare services due to an aging population and increasingly complex and long-term conditions. So for that reason, it's essential that healthcare higher education matches this speed of transformation. And it's crucial that innovative and modern learning methods and principles are embedded into curriculum design throughout the learning journey to ensure that our future healthcare professionals are adequately prepared to address these challenges and evolving patient needs. Just before we start, I'll just say that unfortunately, due to the election being announced yesterday and for reasons beyond our control, one of our speakers, Linda Hindle, has had to cancel today and sends her apologies. Linda's the Deputy Chief Allied Health Professions Officer for England at the Office for Health Improvement and Disparities, and she was going to speak to us about supporting the inclusion of public health, health inequalities, and environmental sustainability as part of AHP pre-registration education. And the Council actually has a survey in circulation at the moment that you may have seen for the last few weeks in our bulletin. And this aims to get a picture of how well public health is embedded in AHP pre-registration curricula in the UK. And we encourage those of you who are listening today to fill this out if you haven't already, or pass on to your AHP program leads. So we'll send the link to that survey in the chat and also via email with the slides after this session. And then just some really quick housekeeping. So this session will be recorded and it will be posted on our website and YouTube channel, and slides will also be shared with attendees. There will be designated time at the end for questions, but please feel free to use the Q&A box to ask questions throughout the session, and then we can get to those at the end. So please make sure any questions go in the Q&A box at the bottom of your screen and not in the chat to make sure I don't miss them. But please feel free to use the chat to introduce yourselves and network otherwise. So now I have the honor of introducing our speaker for the session, Dr. Kate Knight, Associate Professor and Head of Practice Education and Simulated Learning at the University of Chester, who is going to discuss innovative and creative models of practice learning to rebalance health and social care experience across pre-registration programs. Take it away, Kate.
Thank you so much, Stella. Is that sharing okay from your end? Yeah,
perfect.
Lovely. Thank you so much for having me, and welcome to those who've been able to join the call. I am Kate Knight from the University of Chester, but also Cheshire and Merseyside Practice Learning Lead, and work with an amazing collaborative in Cheshire and Merseyside where practice partners and universities come together with students to innovate, work together, and create new ways of thinking. So I'm going to share some of those things today, and I'd love to take questions at the end also. Then I'm going to think about promoting creative models of practice learning and what we've been up to at Chester and how it might help you potentially in the future. But really with a passion to rebalance health and social care. And I'll talk to you some more about that, but that's really our mantra coming from Cheshire and Merseyside. We're also going to focus on all types of learners. So my role is Head of Practice Education and Simulated Learning, and I oversee all learners from social work, nursing, midwifery, AHP, art therapy and SNAs. And within our collaborative, we've got a real multidisciplinary team approach to make sure that we can promote interprofessional learning at all opportunities. So hopefully that comes across today. So for those who aren't familiar, the University of Chester sits across the Northwest, West Midlands and Wales in terms of our practice partners, which gives us a really, really wonderful opportunity to have city-based practice learning opportunities for our learners, but also those more geographically challenged, but also rural areas. And that brings a real nice suite of practice learning opportunities for all types of learners. So, as I said, we're going to think about innovative models of practice learning, and I'm going to focus on where we started and how it's grown, and then hopefully you'll have some questions about that. Thinking around the growth and opportunities, and hopefully some networking opportunities from today, and health and social care, and you'll note there and is in capitals. So we have some challenges around some of our curriculums, nursing, AHP, that might favour health more than social care, and we can think about that as part of a debate. Obviously some learner feedback is involved, and thinking around the importance of preparation and support. I've popped my email address there, so if you want to follow up after the webinar, please do get in touch, and also my X or Twitter handle as well. Please do connect with me, that would be wonderful. So what we're all about. The picture at the bottom really is one of my favourites and sums up a lot about what we do. So in Cheshire and Merseyside and in the Midlands, we've really reignited an ability to work with, we say alternative placements and innovative placements, but actually it shouldn't be innovative, it should be the norm. So back in 2018, particularly within nursing midwifery, we had the a challenge, I suppose, in terms of the triple SA, or the student supervision and assessment standards that came out. Now, they came out, and then obviously COVID hit, so that's a challenge in terms of dissemination. But one of those big changes that came about through those standards changing is that some of the amazing placements and practice learning opportunities that our learners had before were then closed overnight. And in Cheshire and Merseyside alone, we had to essentially 300 plus placements closed. And the reason for that is because they didn't have health and or social care registrants in them. However, many of these areas are absolutely fantastic learning opportunities for students across all of our programmes, whether it's medical, non-medical, and actually meeting people from all walks of life and all needs. But because they didn't have registrants in them, and the triple SA standards obviously make sure that practice assessor require nurses if they're nurses, etc., and practice supervisors to be health or social care registrants, we were unable to use those. But because of the pandemic, and obviously people were distracted by the pandemic, nobody told these gorgeous placement areas why. So overnight, 300 placements closed, but nobody from universities explained why that was. So we've spent a lot of time over the pandemic and afterwards reigniting with these fabulous areas, and actually apologising to say, we used to work with you and that was wonderful. Standards change, we never really told you, but we'd really like to work with you in the, moving forward. However, because things have changed, we now need to change the way we work with you. So that's been a bit of a challenge, but really exciting. So we've reignited these placements to work with people across the lifespan, obviously with people with learning disabilities, challenging behaviours. Really important that we work with different people with language difficulties, clients with mental health diagnosis, and obviously different cultures and situational backgrounds. We've also got a whole stream of new placements that we've never worked with before, and they've never had student nurses or AHPs or medics before. And actually, this is a really exciting time. So over the past 2 years, we at the University of Chester have coordinated the opening of these placements across the whole of Cheshire and Merseyside. So that's on behalf of the University of Chester, the University of Liverpool, Liverpool John Moores University and Edge Hill University. So across those 4 universities, obviously there's a whole array of programmes. We've opened about 250 to 300 new placements in 2 years. And we are, thrilled to bits with that. That has, helped us massively in terms of making sure that our students are meeting people at the heart of everything that we're doing. They're meeting a whole range of people, but also, we're promoting that personalised care agenda. So for those who haven't heard of Percy, which is the little logo there on the right hand side, Percy is a fabulous positive network, which is chaired by Michelle Howarth from Edge Hill University. And it's not owned by a university, it's basically an international network of people who are passionate about promoting personalised care and getting it back into education. So if you are interested, do get in touch with myself or Michelle, and I can pop her email in the chat to join us on this endeavour. So the types of placements we've opened, and here's a picture of one of our placements that this particular care home shared on their own social media and allow us to use it in presentations. We've opened care homes as placements for all types of student, domiciliary care, rehab centres. We've got a massive drive on social prescribing, and I'll talk to you some more about that shortly. Any support services, so things like citizens advice bureaus, hospices for children and adults, nursing homes, any social enterprises, colleges and schools that have specialist provision, and that's really important, and everything in between. Really, we work with women's refuges that support women who've perhaps recently suffered domestic violence or come out of prison. So the learners are able to communicate and meet and support people across all of these wonderful areas. But one of the biggest challenges in a lot of these areas, particularly places like care homes, domiciliary care, and we're a big supporter of social care areas and social prescribing, is they don't have registrants in. So what we have done is had an innovative practice learning model to help us support that. So let me just move on. There we go. So Walt Disney started with a mouse. We started with Mr. Tickle. So Mr. Tickle comes everywhere with us because we often talk about, we hear the term long arming. Now, long arming isn't a term that is supported by the NMC, but in terms of AHPs, it's allowed, but it helps us to understand what the model's about. But the correct term for long arming is indirect supervision and assessment. So if you're an NMC programme provider, make sure that you're using that correct terminology. And I've worked directly with Paul Holt from the NMC on this particular area because lots of people said to me at the beginning of my journey on this, several years ago, is would the NMC like it? Are the regulatory bodies okay with this model? So when you get copies of the slides, I've popped the NMC, then you can just link directly to the indirect supervision page that's recently gone on the NMC website, so you can actually pick up the wording. But what this model of supervision and assessment allows us to do is to utilise these placements, these really rich placements, but be able to be compliant with the supervision and assessment standards. We also use a form of long arming with dietetics, art therapy, etc., and making sure again it's in line with HCPC. So we open the practice learning environment, and we have a team. If I give you an example, at the University of Chester, I have a team of indirect supervisors and assessors. So we've got 50 nurses who work for us on a 0 hours contract, and a lot of those nurses actually work in the NHS in social care as their normal job, and then they come and work for us on this as an extra role. And what that means is they are trained to work with us on our simulation placement, on our private independent voluntary organisations, and also on our creative health placement, which I'll talk to you about. All of the areas that I've just shown on the last screen have a nominated person or nominated people, and that's they're named and the students are well aware. We also then make sure that both the simulated practice learning and these private independent voluntary organisations are supported by our team of indirect staff. So they work in pairs. We have a practice assessor and practice supervisor who then can go into these areas and support the learner. Now, the people on the shop floor, if you like, if we think about the Women's Refuge, then those support workers will be working with the student day in, day out, and then the supervisor goes in weekly to visit the student and work with the student and the nominated person, and then the practice assessor would then go in at the beginning, middle and end, like in any other practice area. Most people say, well, Kate, how do you fund this? How does that work? You've got a team of 50 people. How does all that work? So you can see on this slide, we've got an internal simulated practice learning placement. So we have all of our first years do 4 weeks traditional simulated practice learning, where they have the indirect practice assessors and supervisors supporting them, so it's fully SSSA compliant, but that accrues NHS England tariff because we are a PIVO in our own right. We also have a 4-week creative health simulated placement, which all first years do, and again the same SSSA applied, and I'll give you some further examples. But because we are able to accrue that tariff internally, we then speculate to accumulate. We are able to utilise that money and reinvest in that education of those learners and support the indirect team to assess and supervise out in private, independent and social care and the likes. We also make sure that the practice assessors and supervisors obviously triangulate with the academic assessor. And because we have a bank of separate staff, they're not our substantive staff, none of those would ever be an academic assessor, so there's no chance of an overlap. So our integrated care system recognises this model and are delighted, particularly in the social care space. Social care we've all had a really difficult time, but social care particularly has had a difficult time in lots of ways. So obviously with the pandemic, we're all well aware, but also when curriculums, the most recent curriculums have been brought in, you know, many would say that there's more of a focus on more of a medical model approach, particularly with nursing proficiencies and midwifery proficiencies. And across the country, lots of practice learning leads say to me, you know, we know students can, I'm not sure chase is the right word, but focus on those proficiencies in order to make sure that they pass their programme. But what that means is it's coming against that personalised care agenda, and it's becoming about those proficiencies or skills, and we need to come right back to make sure that the person is right at the heart of everything that we do. So our integrated care system is really supportive of this, because by getting students out into social care placements, it's rebalancing that model. So to make sure that students are seeing health in a traditional health setting, but also community, private, independent, social care type placements. We also map our new placements to all the proficiencies so that students can see the opportunities available. So you can see here some lovely feedback. I think it speaks for itself. So the holistic approach and exposure to the wider system and support, and that's really important. To be able to see the person's journey and work to see what goes on behind the scenes. So, for example, in nursing home settings, you don't have the wider multidisciplinary team right there in your building. How do referrals work? How do we need to think about commissioning, things like that? Great experience equals future roles. So I always say students have to try before they buy. So if they don't have an experience in these wider settings, they're never going to get a job in them. And we've had some students who've gone into some of these voluntary settings and after their placement stayed on as volunteers, which is so important. But also some of these areas have actually created roles for nurses of the future, which is really, really positive. Exposure to complex care and referral pathways is so important because we need to understand how that works to be able to support people fully. Some of our areas find it's really helpful to have links with the universities for that collaborative work, and it certainly helps when areas would like to get involved in research or looking for support with grants, things like that. Partnership working is really important. Students can promote the student nurse role, and actually it might be that people within the placement might want to go on and become healthcare professionals in the future. But also students are our eyes and ears. They go out into all of these placements and they see best practice, they see some not so great practice, but then we can support that area in whatever they might need, and it can leave a really positive mark. So we have a team, we're very fortunate. We have a team that initially we've had funding from NHS England across our 4 universities, who are practice education facilitators for our private independent voluntary organisations, social care and primary care. So what many of you will know is that all NHS trusts have practice education facilitators, and so the second there's an issue, we've got that brilliant support service, they're really proactive, etc. But certainly in many areas across the country, these other areas, so PIVO, social care and primary care, don't have such a facility. So one of the things I get really concerned about is then the safety element of that. Who's looking after the safety of these placements if we don't have a team, or yes, the universities will have link lecturers to look after them, but think about that's done on top of their normal day job. So think about the quality of that and the governance. We have a team who does all of the educational governance and audits of these particular areas and make sure they're safe and they're good, high quality learning environments, and which types of learners should we be sending into these areas? What's the right one to do? Is the student support suitable? Is it good quality? And if it's not, what do we need to do about it? And also we need to make sure we're educating the staff in those particular areas. So this team make contacts, do lots and lots of site visits, hold virtual practice meetings all time of the day and the evening to make sure that people can be released to have those drop-ins. And we've increased the capacity, particularly across nursing, TNA and occupational therapy. We're doing some really positive work around OT, and the OTs are trained at the University of Liverpool, but this central team open for them. We've also provided resources for the region, so a welcome pack. So that goes out to all areas and they can adapt that, but they're not starting with a blank piece of paper. We do practice assessor and supervisor drop-ins, and that's across nursing, midwifery and AHP. We've provided a OT flowchart to make it a lot easier for people to guide, and we're just working on a physiotherapy one at the moment. And a key thing is guidance on the contracting and setting up of the placement system. So we have 2 administrators who really hold the hands of these people to get through the contracting, because it's really quite tricky. And we're just about to embark on the new NHSE agreement, so they'll be flat out doing those. So these types of placements, again, some really nice feedback. It allows students to be placed in a wide variety of organisations, gives an invaluable holistic placement experience. It's a great model that allows placements that we didn't have before by using this indirect supervision. A student at the bottom there, I've met many inspiring people doing amazing work at this time of crisis. And obviously it's really rewarding to work in. So they speak for themselves. This picture in the middle is wonderful. It's our student nurse choir. And if you can have a look on our social media at the University of Chester, you'll see lots about our choir just recently. And this is part of our creative health placement, which I'll talk to you about now. So all of our first years, so 450 first years, go through creative health placement, creative health simulator placement. And what they do is they work with artists and therapists, so art, drama, music, etc., to work in a social prescribing capacity and then linking out into the community to utilise these skills and support partnerships and local community groups. So one of the examples is mums and babies who sing with a choir, and they've been referred to this particular service, perhaps from their GP or health visitor, because they need to be meeting new families and also perhaps some support with their own mental health. And so our students work with these particular artists and take these out into the community, but also invite people in. And what a joy it is. And it's, really impactful on the well-being of our communities, but also on the students. It didn't come without its challenges. So at first, we had lots of feedback when we piloted it, some students saying, well, how does this link to being this particular learner? And we had a lot of work to do, and that really the importance of preparation. But actually, some of our biggest critics have been some of our biggest supporters now, and I've actually become nurse researchers on this particular endeavour. Again, some learner voice, very positive placement with wonderful interaction, very inspiring, etc. One of the things I'd like to just talk about is I've recently worked with a student who has just gone through the creative health placement, and he said to me, Kate, I'm really glad. I was a bit skeptical, and I'm really glad I've done it, because some of the things I've learned, I realise now why my parent acted the way they did towards me when I was younger. I'm starting to piece together some issues around my childhood, and actually I'm going to use some of these wellbeing techniques to move forward, and that's incredibly powerful. So that's another placement that we use the indirect supervision. And then another area that we use our indirect supervision is our Oscar, so Outreach Skills Clinic for Assessment. So we have Oscar on tour, and that goes out, it's a team of our staff who go out to colleges and schools. And we have Oscar Traditional, if you like, and that supports all learners from across all of 4 universities in Cheshire and Merseyside to do some of those tricky proficiencies. So whether you're a physio, whether you're a physician associate, whether you're a nurse, you can actually then come along and learn together perhaps how to do chest auscultation. You might be a dietitian, a mental health nurse, and a children's nurse who might want to come together and do nasogastric tubes. So the team here are mobile, so they can go out to different areas and work within the trust or out of the trust and support learners together. And this is an NHS England funded opportunity, but also it's a placement for students. And then we also have, as a sister project, Oscar Social, and this is linking back to my first slide around rebalancing health and social care. So this is where we borrow it's like a Sainsbury's van, to be honest, size bus from the university once a week, and its usual job is to go around schools and talk about digital skills. But we borrow it once a week, and we can go out to care homes and nursing homes, and it's to support nursing registrants on some of those tricky proficiencies, so venipuncture cannulation, catheterization, etc., etc. So the idea is here that it's actually upskilling these social care registrants, they'll also be able to support students in the future, but ultimately, hopefully, improve patient care. So we've just worked with a hospice locally and trained or updated all of their registrants on catheterisation. And then a few months later, we had a report back to say that their levels of UTIs, urinary tract infections, had dropped since the training. So we are delighted with that outcome. So we're just doing some of those measurements at the moment. If we don't have the bus on that particular day, our team of practice education facilitators who run OSCA go out in their cars and have all the equipment. So it's not essential that we have the bus, although it's fabulous. And one of the things that I'm hoping you might have heard of before is to help all of this. Sorry, just to go back on this one, that we also use the indirect supervisors and assessor model to make sure that we're absolutely compliant as well. So in order to support all of these things, students need to know what they can and can't do out in practice. So we've developed, in collaboration with lots of universities, guidance for the assessment of proficiencies. So this is in nursing up all 4 fields. We've just launched the midwifery one, which we can share with you, and also the student nursing associates one as well. And you may have seen the Skills for Care document here at the bottom that also talks about different social care placements. And we're at the end of that document as a case study for some more examples. So that's a bit of a whistle-stop tour of what we're about. There's a QR code there that you can have a little look for some more information, and there's further links to some of the things I've talked about. But also we'll pop the link into the chat directly. But thank you so much for listening, and I'd love to see if there's any questions or thoughts, comments.
Thank you so much, Kate, for sharing that presentation and for those really, really interesting models. I really liked what you said about these placements. They shouldn't be innovative. It should be the norm. Because, often innovation is viewed as just using the latest flashy thing, but it can also just be trying something different. So just trying a new way of learning or a different placement setting, and that can often be even more beneficial for students. And also, I noticed that what you said really reflects the recent review by the NMC on nursing and midwifery practice learning, where a key priority was ensuring there's not only the quantity but the quality of practice placements available to meet workforce needs, and also to explore more innovative approaches to practice learning. And the work that you're doing at the University of Chester really reflects that, and I'm sure all the members listening in today will feel really inspired from what you've shared.
Thank you, Stella.
So we do have time for questions. So please do put your questions into the Q&A box. I might just start, I'll give the audience a couple of minutes to put their questions in, and I might kick us off with one of my questions, if that's all right. So you've definitely touched on this, but my question is that given that patient needs are constantly evolving and they're becoming increasingly complex, how do these models that you've shared help to ensure that our students are equipped with the knowledge and skills needed to face these real world challenges?
Yeah, and really important, and sort of about the ethos of what we're all about. So, students have lots of fabulous placements and can see some acute care, chronic needs, etc. But it's about seeing people in their own environment where you don't perhaps have, a pathway that's obvious, or it may be that we're going out to charities who actually can support health back the other way. And I think with the complex needs and the challenges in terms of services, I think it's really important that learners know what's out there, out in their community, And our students, as part of their simulation placement, do a neighbourhood study and actually go out and find out what's around them. And when they feed back, they didn't realise that, but are now able to take that into their next placements and share those ideas.
Yeah, excellent points. And there's also a thing about in simulation, seeing more variety and a wider breadth of scenarios than what you might encounter in real life practice.
That's true.
Yeah, comes into preparing students really well. We do have a couple of questions in the Q&A. So got one here. How can other HEIs learn from these practice learning models and support the development of innovations such as these? And what sort of support would they need?
So I think when I speak to lots of HEIs, sometimes it's about having the courage and support to just go for it, I would say. And certainly before the NMC just clarified some of their SSSA standards on their website, there was definitely a question I got a lot about, would the NMC like it? You know, is this allowed? So I think ask the question. You know, the NMC are very approachable, and if you want to try something new and you're a bit worried if it's going to be compliant, ask the question and they'll be very keen to support you on that to get it right. Also, we've had visits from other HEI, so peers, visit from the NMC, etc. And, you know, ask people to come and have a look for support. The other part is having a really honest conversation around your placement tariff. If you're a university that uses simulation, have a really honest internal conversation about how that's used, where it's used, and how could you reinvest that for the greater good of education. And certainly in the new NHSE education contract, one of the biggest changes in there, as far as I believe, is that that's going to be monitored more carefully. So actually we can demonstrate that really clearly, but that's a question to ask your own institution.
Thank you, that's really useful. We have a question from Ruth Patterson, and she says, there are some really innovative initiatives. Thank you, Kate, for this. Just wondering, do the students evidence any of this through any of their theoretical work or through more formal reflection on their practice learning?
Yeah, really good point. And we want to make sure it's a thread right through. So one of the things that we are really proud of is that our philosophy for our actual undergraduate nursing programme, and we're influencing others, is this creative nature, really. So even some of their theoretical assessments are based on creative methods and arts. So it's really bringing the golden thread right through the programme, and obviously a lot of theoretical work is based on patient care and things like that. So yeah, we are really seeing that come through, both in their work but also the way they talk to other potential learners at open days and things like that. It's really starting to come across.
Brilliant, thank you. We have another question. The questions are all coming in now. From Karen Chandler. How do you encourage placements like primary care to consider student placements with the variations in student tariff?
It's really challenging, Karen. So we know there's differences between medical tariff, nursing tariff, AHP, etc. We have done a lot of work, or doing a lot of work with the training hubs across the Northwest, the primary care training hubs across the Northwest, to actually map out the types of learner in all of the different areas, and looking at it from a training hub approach, a primary care network approach, right down to granular level. And we are doing some quite in-depth analysis of, we can open primary care placements for different types of learners, but actually what's booked the other end sometimes looks a little bit different. So we monitor that quite closely, but right from the very beginning, we have a very open and transparent conversation about the challenges around tariff. And actually, you know, like I said before, if you don't try, you won't buy. If nurses don't get the opportunity to experience primary care, they're never going to go and work there. So it's a workforce issue, but it's not without its challenges.
Thank you. And Karen's just put a little add on to that. Has this influenced how many academic credits you allocate to practice modules?
No, so we haven't changed our programme in any way, but we're making sure that the students get the widest experience possible. One of the things, just to add on that, actually, that's just triggered me to remember that the indirect supervision model is quite an interesting title, because we actually get better feedback from the indirect supervision than direct supervision, because the indirect supervisors come and say, Stella, tell me about, you know, what you've been learning, and let's, you know, in-depth conversation and go through everything. Whereas, you know, in reality, for some of our direct supervisors, perhaps on a busy ward or somewhere, it's more challenging for that learner to get that one-to-one time. So it's quite an interesting issue, because if we have students who have indirect first and then go to a busy ward, their expectations can be a little bit skewed. So that's been quite interesting.
Great, thank you. So this question says, hi Kate, your talk has been really informative and inspiring, thank you. I'm in the process of working on a project for developing placement pathways within mental health within the GM catchment area. I just wondered if you had any words of encouragement or advice with regards to how to get PIVOs and trusts on board.
Yeah, really important, and actually spending time to get to know the areas and be honest about what you can offer and what you can't offer. One of the things we'd like to get better is having, you know, a button on every university website to say, if you want to work with us, click here, and it comes centrally. That's a challenge I haven't won yet. But it's about having those relationships, working with your integrated care system, going out, knocking on doors, you know, meeting people. Initially we did that, and then it snowballed out of control, and we onboard now once a month, because we get so many inquiries across. So we have one email address that covers the 4 universities, and we get so many emails per week. We now onboard once a month. So we send a little holding email to say, we'd love to work with you, we'll be doing an onboarding on this date, we'll be back in touch, because we were literally doing it every day and we couldn't keep up. So often, by initially, I suppose, getting a bit of your reputation to be open for business, if you like, then, you know, they talk to another charity, etc. And it links back with the question just a little bit higher there, Stella, about Chester and long gone support across 4 universities. So at first we were the only university to do indirect supervision, but what happened was another one of our universities, who had these gorgeous placements but didn't have registrants in them, actually handed over loads to Chester because they couldn't use them because they wouldn't long on or indirect. And that very quickly is not a good idea. You know, you've got to make sure you support. So 3 of the 4 universities indirect supervise for nurses, and all 4 indirect across AHP and nursing, depending on what they do. So it's been a sort of domino effect. We don't provide, our bank is for Chester, but the other universities, some of them use their substantive staff, and there's pros and cons to that, because you're obviously paying them when the students aren't on placement. But everyone's got slightly different models, but ultimately doing the same thing.
Thanks, Kate. That's really good advice. Just, yeah, goes to show, just give it a go and ask the question, and you often shall receive. And yeah, we just had another comment from Karen about the previous question, and that's interesting about student feedback, Kate. I wonder if this gives the students more autonomy in their thinking and analytical skills.
Yeah, on the whole, and you know, certain placements and practice learning suit certain students. Honestly, some of the placements that we get and that they are more autonomous, but also they're seeing the challenges and the complexities of the types of clients, patients, and families that are being supported. So for some learners, depending on where they are in their journey, can be a bit scary. And others really, you know, run and thrive with it. So that's why it's really important to have that dedicated practice facilitator team, because they can go out and support that bespoke care. And I think on that, it's really important to have those eyes and ears out there. So one of the things, we had a student who'd been out in a PIVO. She'd been there for, well, there's two students, they'd been there for half a morning, and they picked up a safeguarding concern in that particular area. And they escalated that concern and through the appropriate channels. And by lunchtime, we'd got a team in. They'd supported the member of staff who needed to be removed was removed, and the client supported and all made safe, referred to CQC safeguarding, and an MC exception reported by the first lunchtime. So the power of having that support is so important, because actually that client is safer for the students having been there. The students were did exactly the right thing, you know, were absolutely fantastic, but then making sure that it was supported. We then re-audited that area, and, you know, absolutely fantastic. So it's all about preparation and support, I think, are the two things.
Excellent, thank you. Probably got time for a couple more questions. We've got one more in the Q&A, and then I might ask a couple at the end. How do you manage collaborating with other universities, as this can be difficult when competing for students?
You know what, we were only saying the other day, so we meet every Tuesday, all the practice learning leads across the universities, and we also work really closely as a Northwest group. So we have a Northwest practice education group, which is quite unique, really. And we were already saying the other day at our meeting how lucky we are as a team of practice learning leads. We've got that support. So yes, everyone's in competition, and but that collaboration, particularly during COVID, is so vital. So during COVID, you know, we became stronger together. You know, things like having a risk assessment, COVID risk assessment across every type of learner, from medicine, AHP, everybody across the whole Northwest. They all had the same document. And so what it proved is we can do it even in the most challenging of times. So everything we do now, we try and put in either as a Cheshire Mersey region, or we try, if we can, the whole Northwest region, because you're stronger together. And actually the learners are learning together out there, and we want to encourage that. So the more we can work together, they therefore can work together. And what's really important is, if there's an area, for example, that safeguarding concern, say there was 2 university students in there, we've then got that joined up thinking to support all learners in an area, not just our own. So I think we're very fortunate, but I think it really shows some, you know, excellent practice.
Yeah, all really good points. Thank you. I've just got one question from speaking with my policy team. So we've been recently seeing a push for more integrated care and more join up between the education and the health sectors. And the council actually recently held a webinar that delved into where universities integrated care systems in relation to their boards. So my question is, what strategies or partnerships can help universities to collaborate more effectively with their integrated care boards, so that placements like these can become possible, and to ensure that healthcare curriculum remains relevant and innovative?
So universities need to be around the table, and we need to not just, tell the integrated care systems what we're doing. We need to plan this together. So it's, we've done it from a sort of risk assessment point of view. So when we've put in these types of innovations, it's around looking at what the risks might be. So, another byproduct of obviously having these fabulous placements is it also creates capacity. So, and that can be classed as a risk. Another risk is around, only providing a health workforce pipeline and not a social workforce pipeline. So that really make sure the integrated care system are hearing that and are very active, because they can't have no pipeline coming into social care. But actually the way curriculums are, that's a risk. So I think once we've discussed risks with the board and not just saying these are the problems, we're coming with solutions to say, we've seen the risks coming ahead, can we work with you? And actually that's been a really, really important partnership. And we've got, in Cheshire and Merseyside, we've got a practice learning collaborative, and that's actually now chaired by one of the integrated care boards in conjunction with myself as Cheshire and Merseyside practice learning lead. And that's been a bit of a game changer, because we've got the right people around the table.
Yeah, definitely agree. It all starts with universities having a seat at that table so that they're involved in these discussions from the outset, and then, yeah, the rest can follow on from there. So, yeah, thank you for that insight. So it looks like there's no more questions in the Q&A, so I might up 5 minutes early and just draw this webinar to a close. But yeah, the key takeaway message from today is, yeah, give it a go, ask the questions, collaborate and share and learn from each other. Use this as an opportunity with other attendees here. And when we do that, we can ensure that models like the ones Kate shared today can become more widespread. Thank you so much, Kate, for your presentation today. It was really insightful. And yeah, the council looks forward to sharing more innovative work in the sector in the future. And please look out for the slides and resources that will be sent out in the coming days. But thanks very much, everyone. Enjoy the rest of your afternoon.
Thank you, everyone. Take care. Bye-bye.